Hi, everybody. You are listening to Judging Meghan with your host, Meghan Judge. I sound like so obnoxious saying this. And when I do the post, I'm like, everyone's asking. A couple people are asking. Maybe like 2 people have asked where my glasses are from. So not everyone is asking. I hate when influencers or people say that on Instagram. Like 2 or 3 people have asked me where my glasses are from. They're from Benny's Eyewear. Somebody sent them to me. The owner of the company was kind enough to send them to me. And if you use my code judging10, you can like attempt to like look as cute as I do right now after having like 3 hours of sleep post Halloween, where I dressed up as Reagan, the Australian breakdancer, and walked by myself, by the way, with a gaggle of kids. No, I was not trick-or-treating with like a big group of women thinking I was funny. I was alone, dressed up as Reagan, walking down the street, did not care, thought it was funny. I mean, I make myself laugh, and I guess that's all that really matters. Second thing, really quick, my quick story. So I'm lately enjoying a sweatsuit, like I just do. I'm going to bring in Cody in a second. I enjoy a nice sweatsuit. And I walked up to my husband coaches soccer for our youngest daughter, who's 10. And I walked onto the soccer field the other day. I do like this brand, ALO. I think it's pronounced aloe or aloe. I don't know. We'll figure that out at some point. But I do enjoy their sweatsuits. And my husband saw me and he said, "What is wrong with you?" And I said, "What do you mean?" And he goes, "What's wrong?" And I said, "Why?" And he said, "Meghan, have you basically thrown in the towel at this point? You're just going to wear sweatsuits permanently?" And I was like, I look really cute and these are fashionable and I'm not dressing for you anymore. If I was dressing for you, I would be wearing a Spanx slip right now, which you thought looked cute on me. And it's not a dress. It's a slip. So women dress for other women. Let's be real. So I was wearing my sweatsuit. It happened to be white. And he told me that I looked like a snowball. So there's that. He said, "You look like a snowball. You should be ashamed of yourself." I look like a snowball? Oh, okay, thanks. Do not tap me on the shoulder in the middle of the night for anything, because if I look like a snowball, I want nothing to do with you. I think I look cute. Needless to say, that is not being worn anytime soon. Also, one other thing that I want to point out, and this is the end of my rant. I do say ums and likes a lot. And sometimes when I listen back to the podcast, which I don't ever really do because I find myself pretty annoying. And I say ums and likes and it drives me crazy. And some podcasters take the ums and likes out. I just can't. I just want to have like a regular conversation. And I'm an old lady Valley girl. I'm always going to say like, I live in California. That's how we talk. And that's it. We've all been put here for a reason, and we all deserve acceptance.
Judging Meghan with Meghan Judge.
I'm a trauma survivor from a really young age, and I have been diagnosed with complex PTSD in the past few years. I've been surrounded by death and abuse much of my life. I've been dragged through the mud and have been to the point of not wanting to go on anymore. Through my interviews with other survivors, I've learned that there is a way out. From recovering to surviving and thriving, we all have the strength to come out the other side.
You are listening to Judging Meghan.
So I'm going to introduce my guest, who probably is in his brain right now going, where am I? Why did I agree to go coming on this podcast? Cody Hufstedler. Did I say that right?
That's right. Yeah.
Okay. Yeah, I did.
Just like it's spelled.
Okay. Well, you never know with me. I tend to go off on rants and then I don't say the names correctly half the time. I had to have you on. We followed each other on Instagram. Now we're going to kind of get serious. I talk a lot about loss and grief. My listeners know that. And I am fascinated with the end of life. I have been since I was a young kid. And Cody is a palliative. Did I say that right?
Palliative.
Palliative. Did I'm saying that right? Palliative.
Yeah.
Okay. Mm-hmm. Well, I barely graduated college. Chaplain, correct?
Yeah,
okay.
That's right.
And so you also have a podcast called Dying to Tell You. And so you talk a lot about the end of life, and you also help people transition at the end of life. And you're nodding like you feel sorry for me because I'm trying to explain to people what you do.
No,
Am I right?
I don't feel sorry for you at all.
Oh, really?
No,
I do.
no.
I kind of feel. Okay. So Cody, please explain to my listeners and myself exactly what you do. And then I'm going to ask you what you're from, where you're from, not what you're from. That's Halloween.
Okay.
Go ahead.
Yes. So I am a palliative care chaplain. I'm an inpatient palliative care chaplain. So I work in the hospital all the time. That's all I do is work in the hospital. And palliative care is kind of a new, well, it's not that new, but it's a newer specialty that a lot of people don't know about in medicine that is really focused on comfort, quality of life, symptom management, and it is kind of the umbrella service that would include hospice. So hospice is for people who are only concerned with comfort and quality of life at the end of their life when they're not pursuing any life prolonging treatments. That's hospice. But palliative care is comfort and quality of life for anyone with a serious illness, even if you're getting life prolonging treatment or whatever it may be. So somebody may have a cancer diagnosis and it's not something that's curable. It's not ever going to go away completely, but they want to get treatment because they want to prolong their life and they feel like they have a good quality of life and they want to continue that. And so our service would be consulted and kind of follow along with them while they're getting their chemotherapy treatment, and to help them. So a big part of it is our doctors are trained in symptom management. So they help them with pain, nausea, whatever comes up from the cancer, but also what comes up from the treatments, because the treatments can also be hard. And so they follow along for that. But it's a multidisciplinary service. So we have chaplains and social workers to help, address all the needs. And so a lot of what we do is spiritual and emotional support for people. And especially in the hospital, we do a lot of decision support. So when somebody gets a new diagnosis, how do they want to play these cards that they're being dealt? What does the treatment look like? What is the treatment likely to get you? What is the quality of the life that you want? What's the quality of life that you would accept? And how do we get you the most of what we can get you and avoid the most of what you want to avoid? And just how do you want to play those cards? And so that's really my spot in the hospital, is working in that kind of liminal space, the in between space, helping people kind of navigate the uncertainty of a new diagnosis and potential treatment. And I work a lot in the ICU, so it's very serious illness in a very acute time that is often really panic provoking, I guess. So I work with patients and families in those situations, kind of the in between space.
Okay. So now that you explain that, which I find fascinating, tell me where you're from. I was blanking on what I was going to ask you. Where are you from? And tell me why you got into this. So just so you know, I'm a very spiritual person myself. I'm sorry for my listeners for having to tell you about me again, but I want Cody to understand why I find this fascinating. I lost my dad. I lost my sister at 2. I lost my dad at 13. And I lost my best friend at 29. And so I've always been very, I've been dealt a lot of grief in my life, like a lot of people that listen and a lot of people in general. But I always am fascinated by the end of life. Like for me personally, my mom thought it was a good decision for me not to be there to say goodbye to my dad. And so I've always held on to this feeling of like, I never got to say goodbye. And she did that, because she thought it was the right thing to do. And I'm not mad at my mom for that at all. Yeah. But my whole life, I feel like a lot of people understand. Well, I understand life is short, and you understand life is short. And I understand that I'm of a certain age. I'm not going to say it. You can Google it. I'm getting old. Where we never know how much longer we have on this planet. And death is looked at as such a awful thing. I think that it's important for us to understand that just like we come into the world, we're going to go out, we're going to leave the world, and hopefully, I believe, meet our maker, meet the people that are waiting for us. So when I found you and you post things, and I'm always interested in hospice and all of these things, it's because I want to give people some answers and some peace of what maybe you've seen and what you do. Yeah. I know that was a mouthful. I'm sorry.
No, I was going to ask about why, what has brought you to this place of being curious about the end of life. And I can imagine, that much loss that early in life. You said that you didn't get to be part of your dad's passing. Do you regret that? Or you
oh my God, Cody, you're going to make me ugly cry already. I do. You know what? I do. I'm sad about it. And I've lived with it for many, many years because I was 13. And
that's a hard time.
Yeah, I didn't get a proper goodbye, by the way. So my dad, I still have a hard time talking about my dad, and my listeners know this. My dad was diagnosed with leukemia, and he fought for 9 months, and he went through 3 rounds of chemotherapy. And he told me at the very end, even when people were like, the cancer came back, he's not going to make it. He told me, I'm going to keep fighting. Mm-hmm. And so I believed him. And because I think he just didn't understand, how can you tell a young kid, I'm leaving. This is the end. It's got to be horrific for a parent when they're sick and they have to leave their kids, Yeah,
it's terrible.
So anyways, that's my answer is, just never getting that goodbye or watching him transition. I think I wish I kind of would have been there. And I know my mom didn't want us there to protect us, but instead, you're just kind of left going, why for the rest of it? And your heart is broken truly for the rest of your life. Yeah.
Yeah, totally.
Yeah.
Totally. Yeah. I mean, I see lots and lots of ways that people handle that kind of a situation. And some people bring their kids in and some people don't. And they're all just, like you said, they're just trying to protect their kids or trying to do the best they can. They've never done this before. I don't fault anybody for any decision that they make about these things. But I had a cousin who lived in Philadelphia. I didn't see him all that often, but we connected fairly regularly by phone or on social media. And he died a few years ago, and he lived in Philadelphia, and it was during the pandemic and nobody was traveling. And I think they probably had a funeral, but I don't know. And I still have to remind myself that he died. And I just feel like even if I'd gone to a funeral and hadn't actually seen his body or, whatever it is, some kind of goodbye just seems really important because I don't know. There's a big empty space, kind of in my heart.
Yeah.
I don't know how to say that, but I just feel this really, I feel a real empty feeling when I think about him and he's just not here anymore. And I don't know. It's strange when you don't get that goodbye, for sure.
I think it's strange when you don't get the goodbye, but I talk about this often on the podcast. It's, just carrying grief, you're still grieving and carrying the grief all these years later. I think that as a society, people don't talk enough about accepting the fact that it's okay to grieve for the rest of your life.
Yeah. Of course.
I think that it's okay to talk about how we feel and how painful it is not to get a goodbye and all of the things that go with it. So I think all of that's okay. And I think for my listeners that might be listening and you might be newly grieving or you're still dealing with a loss, it's just okay. It's okay to feel sad. And you just saw me, like I still cry about my dad to this day, you know? So tell me, Cody, why did you get into this and where are you from? I'm sorry.
Where am I from?
Yeah. I'm like 14 minutes later and 35 seconds. Here we are, halfway through the
Back at the beginning. So I'm in Denver, Colorado, or I live just outside of Denver, Colorado. I grew up in Texas.
I thought I heard a Texas twang.
Really?
I do.
Oh, okay.
Yeah.
All right. I believe you.
It's a good thing. I like Texas.
I can't help it if I.
Yeah, I like my nephew goes to school in Texas and plays football, so they're all very nice. But go ahead.
So I grew up in Texas. How did I get into this? I grew up in a really conservative Christian church in the Dallas area, and it's a very conservative. It's loosely a denomination, but a very conservative group. And I loved it. I grew up in the church that my grandparents went to and my parents went to. And so I just had these lots of generations of people that loved me and cared for me and really encouraged me and brought me up. And I loved church. I just loved it. And because of that, I think I was a little bit sheltered, not a little bit. I was sheltered. I don't need to soften that language. I was sheltered in some ways. It's not like I was, cut off from the world or anything. I went to public schools and all of that, but I had a pretty naive view of the world and a pretty tunnel vision view of the world. And I wanted from very young age, I wanted to be a minister. I wanted to work in a church. And I really, looking back, think I just wanted to be in my church doing those things for the rest of my life. Mm-hmm. And what I realized, I guess, after going through undergraduate degree and working in churches for a little while is that I was just trying to recreate what I had as a kid. And you can't do that as an adult. I did, first of all, I'm an adult now and I have responsibilities and there's a bunch of stuff that I have to do. Working in churches, you just have, all these people are your boss. They think, they're going to tell you how to do, what to think, what to say, all that stuff. So it wasn't for me. But so I had this background in, Christianity, and I was kind of expanding my worldview, I guess I should say. I started reading things that were outside of my denomination, outside of Christianity, and I was just expanding my worldview. And I knew that I couldn't be part of that particular denomination anymore. I didn't know if I was going to work in churches anymore. I knew I needed more schooling no matter what I was going to do. So I moved to Denver to come to graduate school here, and I went to the Palliative School of Theology. And during that time and the years after, I kind of deconstructed the faith that I had been given and spent some time kind of reconstructing my own worldview. And in the midst of that, I went through a divorce, and I decided I was working in kind of a social work, working with formerly homeless youth, and I was just not satisfied with life in general. And a good friend of mine said, look, you need to go to do chaplaincy training. You have the degree already. But the chaplaincy training is, it's really a year or more of working in the hospital as a chaplain, but also just really intense internal work and really diving into what makes you, what are your patterns, what are the things that, what are the biases you have, what are the assumptions you make, and how do you kind of work with those in order to be present for people in these, high intensity situations. And so he said, look, go do this training. Even if you hate working in the hospital, you'll be a better person for it once you're done, and then you can figure out what you want to do. So I'm just kind of a trusting person, and when people give me advice, people that I trust give me advice, I just take it without much criticism or whatever. So I just quit my job and got a residency, is what it's called, in the hospital. And then at the end of that first year, I wasn't quite done with the work, my internal work, and I wasn't quite done with all the stuff that I needed to do to be certified. So I went for another year. So I did 2 years of training there at the hospital, but I loved it from the very beginning. I loved being in the hospital. Before that, I'd always hated hospitals, but being on the inside and kind of being the person who knows and can help people in the hospital was really, it really resonated with the value of hospitality that I have. And so I loved it. So I put out feelers for a job after like the end of my residence, my second year of residency. And there was a half-time job at the hospital I work at now in the palliative care department. And I really didn't know, I mean, I knew what palliative care was because I'd been working in healthcare for a little while, but I really didn't know what I was getting into. And honestly, they took a huge chance on hiring me because I really did not have the qualifications that they needed for me to have, but they knew it. I mean, but they took a chance on me. I'm forever grateful for those folks that hired me. So I've started working there part-time, worked as a bartender part-time, and then transitioned into full-time work, and now I'm the lead chaplain for the department. But that's kind of how I got to the work. Kind of a
Can I just say
way.
something? Sorry, I'm a big mouth.
Yeah, go for it.
When you talk about what you do, you light up.
Yeah, I love it.
And I always am. I'm always like, oh, I love when people talk about what they do, and they you can tell that it's not just a job; it's like part of who they are, and how fortunate you are to have that, because it's very special. But also, I can relate to what you're saying. I did not go to theology school, but religion in my life, growing up Roman Catholic, right, it was so important to me as a child. I loved the experience of church, the families. We were very close friends with our priest growing up. He would come for Sunday dinner. My dad was one of the best human beings I've ever met in my life. He was very religious. He went to daily mass. Oh, wow. And God was always just something that was like incorporated into our home and our lives. And then you get to a certain point in life, and I've gone in and out of where I am with my faith. And I'm very open about this on the podcast. Sometimes I go, I don't know if I really believe all of this. And I think what I want to say to my listeners, because I do talk about religion pretty often lately on the podcast, is my faith will never, I'll always have my faith in God. And I'll always believe in that there's something beyond this. But I think it's okay as a human being to question things that are being taught to you. And I think it's okay, especially in the climate of the world right now, to say, wait a minute, do I really believe this? And that's okay. I think it's okay to question things. That's part of being a human being. And if you don't question things, then I feel like you kind of are missing out on really, truly identifying what you believe in your life. So I kind of had to say that to you, because I don't know if you agree with me, and if you don't, I'm totally fine with that. But that's what I think. And so sometimes I do go to mass, and I don't agree with everything. And I hope my priest isn't listening and I get in trouble. But I find it something that I do because I find peace in knowing that my faith is important to me, and I just still will always love the process of going to mass, but it doesn't mean I agree with everything that's being said. Yeah. So what are your thoughts on that? I know that was a lot.
A couple of things. 100% agree that it's important to question things. I mean, if you're just taking something that somebody says and just believe it for no good reason, finding out what rings true within yourself, I think, is very important. So yeah, if if somebody is listening and they want somebody who's a chaplain to tell them that it's okay, and encouraged, honestly. I like what you said about how you still go to mass and you don't necessarily believe everything. I grew up in this church that it's called the Church of Christ, and they don't use instruments in their services. So everybody sings, and everybody sings 4-part harmony, and it's gorgeous. And I haven't had that in a very long time, and even still, sometimes when I'm in a terrible mood or I'm distressed about something, these songs will come into my mind or just like pop up for me, and I'll be humming the tune, and it's a comfort thing. It feels like home. And even though I'm humming these songs that have words about theologies that I think are not great, I still find great comfort in just that, whatever that is, that setting. And I think it's probably very similar for somebody who grew up in a Catholic church to go back to somewhere that feels so comforting and so, like a home, somewhere you come back to that's safe and feels good for you.
I love that you use the word home, because I do feel that way. I feel that way, like when I've had to deal with like death or like bargaining with God when I lost my best friend, like literally running to mass when I knew she was gonna die, and going like, please, like, listen, like I need, like, and you understand that people go through that because of what you do and like life in general, but just, it's always like a place, like an actual church, where I feel like no matter what is going on around me. I mean, you don't always feel like this when you're in church. I mean, half the time I'm like, why is that lady sitting there? Everyone knows what she did last weekend, but then there's the times where you're there and you're like really dealing with something. And I feel like I just have this true feeling of being home. And so that's why I continue to go. But again, I don't believe in everything I don't believe in all the rules. I just don't. Yeah. So, okay. So what I want to ask you next is we're going to get into like really what you see, and like what people go through. We know what it's like to go through, or not everybody does, but I would say most people know what it's like, or maybe not most people do know what it's like to have a friend or a family member that's been diagnosed with a chronic disease, or being told they might not make it, and how hard that is for a human being to deal with. And then on top of that, deal with, like, if you're a parent, you have to keep being a parent. Tell me like a little bit about that piece of it, and like, because of what you do, like how you talk to someone, how you deal with the families that you talked about, dealing with people that have been diagnosed with these diseases, and how they know they might not make it to the other side.
Yeah. Yeah. Well, I guess I'd say that a lot of times when somebody is experiencing an acute illness, or they're getting a diagnosis, or their loved one is maybe in the ICU on life support, the way that I kind of view it is we kind of zoom in a lot, and what's happening right now in this moment is really scary. It makes you angry and sad, and all you can see is just this terrible thing that's right in front of you, and it's like right here in your face. And I think my job is to meet them there, right, and say, okay, what is that? What's right there in front of your face, right? What is it? You're scared. Okay, let's talk about that. What are you scared about? What are you worried about? And then slowly, and it often takes a long time. So several days in a row of meeting somebody and talking through stuff. But what we're trying to do, I think, this is how I view it anyway, is help people to zoom out a little bit and say, okay, I know what's happening right here, right now is very scary. And there was lots of life before this that wasn't scary. There's going to be life after this that's not scary. And let's pay attention to what's happening now, because it is scary. And remember that that we don't have to make panicky decisions about what's going on based on an acute emotional response or emotional reaction. And so help them to express that emotional reaction, help them to work through that, figure out what it's about, and then start to address some of those things, and then help them to kind of, I see it as pivoting. So you have all this fear and all these emotional reactions that somebody's having in the moment. And if we can like take it away from right in front of their face, then we can maybe pivot towards, okay, all of that is true, and these things are also true. These things being, these are the things that are deeply held values, right? Mm-hmm. These are the things that make life worth living. These are the things that where you find meaning and purpose. Let's talk about that, because those things are happening right now, but these things are going to be more longitudinal and a better way to make decisions about what's happening. Now, we can't always get around the fear or the sadness or whatever is going to happen. We can't always fix somebody, but we can help people walk away from the situation more whole if we can pivot them towards, okay, we understand that what's happening now is very scary, and we don't have to, we can look and say, okay, but you or the sick person values independence. They value family. Let's talk about that, because the decisions that we're making right now about life support or chemotherapy treatment or whatever it might be need to be geared towards the things that are really important, and not just geared towards the things that you're afraid of. If people make decisions in the midst of fear, they make bad decisions. We all do. I mean, anybody knows that, even if it's not a medical decision. If I'm making decisions out of fear, which has been my pattern in life, I typically make bad decisions, So that's really what we do. Sometimes it involves, if they're a person who's, a religious person or a person of faith, we say, we help them to tap into that. Okay, like if God is who God is for you. So who is God to you? How is God for you? How is God interacting in this? How does your faith help you? How has your faith helped you in the past in difficult situations, and how can we apply that to this now? Sometimes it's not faith, sometimes it's other things. Sometimes it's connection to family, sometimes it's connection to somebody's career or their vocation, or anything can be meaningful to a person, or a place that they find purpose.
Do you at the end, do you deal with patients at the end of their life and give last rites and that?
No, so I'm not Catholic. I'm not a priest. So that's a Catholic priest kind of
separate. Okay.
That's his thing to do.
To be honest with you, I didn't know that was just for that Catholics only do last rites. I didn't know that. So
yeah.
What about?
But yeah, I am around people who are dying in the hospital. It happens in a lot of different ways, but a lot of times it's people that are coming off of life support and then transitioning to hospice or comfort care, which is helping somebody to die peacefully. And so I'm around that a lot in the hospital.
So let's get to that piece of it. So when you're around people that are dying, which I'm assuming is often, what do you see that you maybe know that there's something else? Or do you think that?
back to your statement about questioning things. People ask me what I believe about the afterlife or the lack of afterlife, and it depends on the day what I think, really. I have seen people, quite a few people, talking to or seeing people that have died in the past. Some days I think, God, that is really inspiring and kind of warming, warms my heart a little bit, thinking that, oh, there's somebody on the other side waiting for me. And some days I'm like, I don't know, just like in my scientific mind, and I'm just like, oh, their brain is doing that thing that the brain does and kind of making things up. Does it matter one way or the other? No, because what I see is the people are comforted by seeing their loved ones that have already passed. And sometimes it's like days and days before somebody is dying that they see the loved one in the room with people who are also there. And they're saying, I know you can't see them, but I see them. That's it's weird. It's sometimes a little creepy, but it's comforting to the people. The thing that is I find comforting about working at the end of life with people is that people are really afraid when they get the diagnosis. People are really afraid of death before they get the diagnosis. And this is something that I'm learning in doing the podcast, because I'm learning and having these conversations with people in a different time period than I normally see them in the hospital. But people who are actually dying typically are not afraid. They're fine. It's all the people around them that are scared, sad, worried, all that. But most of the people that I talk to who are actively dying or getting close to coming to the end of their life, they're fine. They see it. I mean, they're sad for sure. They're struggling with saying goodbye. So there's some sadness there. But just today or yesterday, the episode that came out of my podcast, she said, I'm just dealing with this just like you're dealing with your shitty job. I have this problem, you have that problem. I'm dealing with this. I'm going to be okay. Like, yeah, you don't have to look at me with pity. You don't have to use kid gloves with me. You can treat me like I'm a normal person, because I am a normal person. So most people are fine. And I have never seen somebody come into the end of their life that is terrified or, really fighting against it. I think most people, by the time they get there, are tired of living in a body that's not working anymore, or that is actively working against them in a lot of situations, and they're looking forward. People of faith are looking forward to whatever they think might come afterwards, but they're also looking forward to just being done, because being sick is difficult work for a lot of people. Yeah.
What about people, like, something I was just thinking about. What about somebody that's not of faith? Like, I always wonder, I'm like, that would be really hard to know, like, it's the end. But do you think they've just they're at a place of peace of just knowing? Do you deal a lot with that?
I deal with it a fair amount. There was one person in particular who I saw over months of time, and she was really open about the fact that she didn't think anything happened after death, which didn't distress her at all. But she said, I'm still just trying to wrap my mind around the idea of not being here, not existing anymore. And the best thing we came up with was, well, what was it like before I was born? I don't know, but I wasn't hurting. I wasn't in distress. Everything was fine. So that's what it's going to be like afterwards for her. That's kind of what she came to. The but again, I think most people, by the time they get to that place, they've done enough internal work that they're to a place where they just say, I'm ready. I'm tired. This has been a long journey. I did my time, and now's the time for it to be over. And I think most people who have that kind of worldview see life as that. It's just like, this is a blip, and I did the best I could with the time that I had, and I enjoyed it, and now's the time for it to be over. And so most people are okay. I mean, of course, there's sadness still. Like I'm saying, that saying goodbye permanently is difficult, and it's sad for sure. But and anytime you do something for the first time, there's some trepidation. But like I said, most people are okay.
So let me ask you about your podcast. So most of your episodes are that you're interviewing people that are transitioning out of life, correct?
Yeah, it's a real kind of a niche person that's sick enough to be dying, accepting of that fact, willing to talk to a stranger about it, and then let a bunch of other strangers hear it. So it's a unique person that's willing to do that. But yeah, they all have some kind of disease that is terminal. Some, like we had a couple this season that have ALS, which is Lou Gehrig's disease. Some people with cancer. One that's coming out in a few weeks who has dementia. And she's just on the cusp of she's still able to talk about it. She's aware that she has dementia. She's having memory issues, obviously, but she's kind of on the cusp of not being able to talk about it anymore. But I think we caught her at just the right time. So so everybody is dying. Well, you and I are also
we're all
dying.
But yeah.
And that's the thing. Like, none of us are getting through this.
No, we're not.
We're all gonna die. So, and that's a big point of doing this podcast, is that we are all gonna die. And the more we engage with that idea now, the better we'll handle it later on. And honestly, I live my life better because I am aware of that fact. Not that I'm afraid of it, just that I know that it's there and that life is precious. And, all these people that I'm interviewing are telling me about the things that fall away, that are no longer important to them when they know they're dying. And they can focus on the things that are really important. And I know now the things that are important to me. And I know that I have the opportunity to focus on these things that are really important to me, just like they are. I don't have to be dying to live intentional. And
it puts everything into perspective.
It's so great.
I was watching an interview with Sarah Seidner, who's a anchor that I really like on CNN, and she was diagnosed with breast cancer, and she was talking about, like, I'm very open with my listeners and my audience that I've struggled with lifelong depression and anxiety. And there was a point in my life where I did not want to be here anymore. And I'm still here, thank God. Yeah. And Sarah Seidner was talking about how, she struggled, like I was talking about, the same way. And that when she got the diagnosis, she said, wait a minute, I want to be here. Why was I doing? Like, what was I doing? I'm not done. I'm not done yet. Mm-hmm. And so she's very open talking about her fight with breast cancer. But I just found it really fascinating to your point, that, like, to put everything into perspective of, like, life is short. I talk a lot about that. This is my personal opinion. I think we're all here for a reason. I know people hate it when you say that. I do think that. I think there's I think we all have, like, tests and things we have to go through. This is my personal opinion. And then we can hopefully go to what I think is, I believe in God and heaven. But I just thought that that's an important point, and it really struck me when she talked about that.
Yeah. There, we're recording an interview in a month or so with a lady from Australia who got this really terrible diagnosis. And she said she went home just in a panic, which is typical. People have this panic, and she had this like almost an out of body kind of clarity about consciousness and life, and she just felt euphoric almost, as just like we're saying, kind of everything fell away. And she just felt a lot of peace within herself. And she said she felt that way. She lived that way for maybe like a couple days, and it gradually started to go away. And then she found out that she was misdiagnosed, so it wasn't as bad as she thought it was.
Oh,
and
wow.
So she obviously had a little anger about that, but she says she's been spending her life kind of remembering that moment of clarity and peace, and trying to get herself back to that place that she had when she thought she had a month to live. So I think that may be what people are experiencing when I say, people coming to the end of their life are at peace. Most of them are at peace. I think that there's just all the, I don't know if, can I use profanity?
God, yeah.
All the bullshit of life, it goes away. And your family, your friends, the love that you have within yourself, the love that you've given, the love that you've gotten, that like those are the important things. And those are great. Those are peaceful. Those are happy. And there's some sadness associated with the saying goodbye to all of that. But the knowing that it's there, I think, just brings peace to people, and they're okay, I don't know. There's a clarity that comes with facing mortality, and I think that's why I do the podcast. That's why I love my job. It just provides a reminder that I have mortality as well, and even though I'm not, that I know of, not dying right now, I can have that. I can access that clarity more often. I'm not 100%. I'm not great at it, but I try.
No.
Yeah.
Do you, so like going back, like to seeing things or whatever and believing in, like, I know that my mom said when my dad went, it was like he saw someone like, and I know what you're saying about the brain and the brain tricking you. I just have been doing this podcast for 4 years. And I've had so many stories of signs, and in my own life, signs of things that like, I'm like, there's no way that they're not here, or that there's nothing after this. That's just my opinion. Like one girl I interviewed years ago told me that her mom loved this song that was like an old song from like the 1940s or something. And like one day she was cleaning out her house or something, and like all of a sudden like a record player started playing that exact song, like stuff like that I've heard. Or like in my situation with Julie, who's my best friend, I always feel very connected to her, and so my sign is the monarch butterfly. And this one time, I mean, I look like a complete lunatic. I sometimes, when I was in my really bad place, when I was like drooling in a corner during COVID, I would like go on my walks and full on talk to monarch butterflies on like a wood chip path, and people would be walking by like, oh my God, is she okay?
Yeah.
You know, like there's, I don't know, like that's, I guess my question. I know, like, I get what you're saying, that it's like, you wish you could be like, yes, everybody believe, like, this is what I've seen. But I just think, I don't know. Does that, can you answer that?
No,
that wasn't exactly a question.
I mean, I too have seen people, met a lot of people who have previously agreed upon signs. There's a nurse not long ago who said that her granddad, they talked about it, and she was like, anytime I see a penny farthing bicycle, you know, the one with the big wheel on the front. She's like, anytime I see one of those, that's going to be our sign that you're looking down on me. And she's like, they're not around. I mean, it's not something you see all the time, but she's like, I see them all the time. And, you know, I've seen, there was a lady that was in the ICU, and she was like, I walked in and she was crying, and I said, what's going on? And she held up a nickel, and I thought maybe she was delirious or something because she's crying and holding up this nickel. And I said, you know, what's the nickel? What's that about? And she says, I've just been in here ruminating. You know, people are alone in the hospital. They have nothing but their thoughts, and they're just ruminating on what's happening. And she's so scared. And she said, I just looked over on the tray table, and this nickel was there. And she said, my dad said that anytime I see a nickel, that I should know, anytime I find a nickel, I should know that he's looking down on me. And she's like, I didn't have any money in here. This nickel just appeared on my tray table, you know? Where did that nickel come from? Did some supernatural being bring the nickel and put it on her tray table? I don't know. Is it possible? Yes. Is it possible that somebody just accidentally dropped their nickel? Sure. Is it possible that was meant to be a sign? Sure. But I mean, back to what I was saying before, you know, like Joan of Arc, she got in trouble for saying that she could hear the voice of God, and people would say to her, that's just your imagination. And her answer was, yeah, of course it's my imagination. Where else would God talk to me? So, you know, if it's happening everything's happening in our mind. And if it's happening in our mind, it's real. And so, you know, if somebody's seeing somebody in the corner that I don't see, is it real? Yeah, it's real. Of course it's real. And it's comforting. And do I know that do I know what happens when somebody dies? You know, no, I don't know. Nobody's ever come back to tell me. I have my hopes. But I know that those people are seeing that, and I know that it's comforting. Your monarch butterflies, when you're talking to your friend, that's comforting to you. The nickel showing up on that lady's tray table was incredibly comforting to her. Those penny farthing bicycles that show up for the nurse, you know, that's super comforting. I had when my granddad died, and there was another gentleman, an older guy who was kind of a surrogate granddad. Each of them came to me in a dream after they died. They didn't say anything big, groundbreaking, or anything like that. They just said, everything's okay, was basically the message. Super comforting to me. I mean, it just touched me. And I think about it still. Do I know what to make of all that? I mean, I don't know. Did God allow them to come to me in my dream? I don't know. But it showed up. It's real to me. And that's enough for me.
Yeah.
You know, it's comforting to me. And I mean, I would say that for you too. Like, keep talking to the butterflies.
Don't worry, Cody. You'll see me on my walks talking to the butterflies like a crazy lady. No, totally. I mean, sadly, it's like, I didn't expect for you to come on and be like, so listen, I was talking to God yesterday, and he said, like, nobody thinks that. And if you did, people wouldn't even believe you anyways. But
they shouldn't.
Right. But what I think is important is, like, if you have faith, have faith. If you don't have faith, like, have faith in yourself. Like live your life to the fullest. Like, go out.
That's a really good point.
Yeah.
You may not have everybody has faith. Everybody has faith in something. Mm-hmm. And if it's faith in God, that is a well-known faith. But a lot of people have faith in other things. A lot of people have faith in their family. Mm-hmm. A lot of people have faith in themselves. A lot of people have faith in peace or the universe or the Spirit. What, you know, I don't even know what all people have faith in, but everybody has faith in something, and everybody has something within themselves. There's a place in you that you can access that is full of peace and joy.
Yeah.
And, you know, it's something available to us. And I find myself being able to access that more and more often, the more I do this work and the more I kind of interact in this field. And, you know, again, I'm not here just to plug the podcast, but that's part of the reason for doing this, is so that people can have access to that. You know, just remind themselves from time to time, life is short. Things, like, we think all of these things are important. We think all of the, you know, my bills and like making money and all this stuff, we think that's important, and it is in a way, but the things that are more important are the things that bring us peace and joy, and the ability to, you know, live and practice our jobs and stuff with equanimity, and that's, and I feel like I believe that we can access that more often if we are paying attention to our own mortality, which, you know, it's a bias because it's what I do, but you know, the ancient Stoics believed it, and I think the Buddhists believe it, and honestly, Christianity believes it too, because they're constantly putting Jesus on a cross in the sanctuary, right there. It's in the church always. You know, death is in front of us, and if we engage it in the way that we can, it will help us live better now, I think.
I love that. I think I'm so happy I met you and we connected. And, you know, I think this is a very important topic for people. Everyone at some point is going to go. I already have my, my little slideshow of photos that I want to be shown at my funeral.
Are you keep adding?
I'm joking.
To them, right?
I'm
you
joking.
don't?
I'm keep adding. No, but I'm like, I've told my husband, like, I'm like, you know, this is what I want on my, like, this is what I want. And he's like, you're insane. Why are you talking about this? And I was like, I just really want people to, like, I don't want like a bad picture of me on my, like, I want like a picture that, you know, that I would like, not like some ugly picture that somebody's friend is trying to get revenge on me and puts on like my program. I want access, and I will haunt everybody. Like, you know, like I joke, but I think that this topic is important, and to remember, right, especially now in this climate in the world, like how we treat each other, what we say matters. And it's just important how you live your life. And as they say, you can't take it with you. Yeah. So like, and I'm guilty of this myself. I just talked about my obsession with my sweatsuits. I'm not going to be able to take my sweatsuits with me.
No.
So like, let's be kind. Let's like continue to try and be good people and like live our lives trying to help other people, I think is really important. So Cody, where can everybody find you in closing?
Yeah. The easiest way to do it is to go to the Dying to Tell You podcast website, which is dttypodcast.com. All of the social media and stuff is there, but you can listen to the podcast there. We're on Apple and Spotify, and you know, where else do people get podcasts? Apple and Spotify.
Apple, Spotify. Like sometimes people listen to me on like iHeart, like some of them I'm like, yeah, I'm like, I didn't even know, like that kind of stuff. But yeah, Apple, Spotify. Yeah. And I love what you do. I'm so glad we connected. And in closing, I just think it's important to always tell people, keep going. You matter. Your story matters. Thanks, Cody.
Judging Meghan with Meghan Judge.